Good morning, I'm Diana from the lab. I'm going to get some blood from you today. Can I get your last name
Smith,
and your date of birth, please?
7/1961.
Okay. We're going to find your vein first. And we're always going to feel because the one that looks the best is not always the one that feels the best. The veins are still a little small, so I'm going to use a syringe on this, okay?
Okay.
It's okay if you need to get that first, and then we'll get the blood. Clean it with some alcohol in a nice circular motion, and then we can either let that air dry or we can wipe it with a clean piece of gauze. We want to make sure that we insert the needle with the bevel up, which means the slanted part goes up, and we're going to make a nice smooth motion as it goes in. There's going to be a little stick. We're going to pull back slowly on the syringe. And we want to pull back just as fast as the blood will fill. We don't want to jerk it back and put too much pressure so it collapses the vein. Once we have our blood, we're going to untie the tourniquet. We're going to take a piece of gauze and put it over the needle, pull out, then push down. Can you hold that for me?
Sure.
One of the biggest things with the syringe is we have to change to a blunt needle or an adapter to get the blood into the tube. And we need to make sure that we do that rapidly so that the blood doesn't clot. And the blunt needle won't stick us even if we carefully going to remove this. We would fill all of our tubes, and then when we're done, we just get rid of the entire syringe. We're going to check and make sure that our patient has stopped bleeding. And would you prefer Band-Aid or a tape?
Tape, please.
And we want to tape it down nice and tight, put a little bit of pressure on it so that it stops bleeding. Before the patient leaves, we're going to label the tube properly. Many places have pre-printed labels for this. Can I get you to spell your last name one more time?
SMITH.
And your date of birth.
7/1961.
Thank you. And have a nice day.
Thank you.